All right, Brian, so the Stecker Chams, here's your, this is why you can't get your extension. You got this big old bucket handle tear of your meniscus sitting right in the middle of your notch. We're going to put this back down to where it's supposed to be. You should be able to get your extension back once you do that. This is actually a complex tear. You've actually teed it off. That's not going to be something we repair. It's going to be something we clean up. But look at the cartilage damage that you've done. You've done a tremendous amount of damage to this femoral condyle. See how you got almost like a shark bite in there. And you see all these loose pieces floating around. They're all coming from right here. Let's take a shaver and clean that up a little bit. So you can drop the table a little bit, sorry. Thanks. So we're going to take a shaver and get these loose fragments out. You see all the synovitis that you have also in your knee. We'll take the synovium out so we can see everything better. Look how ratty that meniscus is. Take a probe. It's almost split in half. And you see this very unstable, but split right in half here. That's not a repairable type tear, unfortunately. We're going to take that piece out. We're going to come from the back and look how torn up it is back here too. Cover the Predator, please. Cody, can you do me a favor? Can you tell Paul to come in here and... All right, so we were trying to save you as much meniscus as we can. I think we've done that, at least taken out only the stable. And then we'll see that we got to clean up this transition area. The posterior horn looks nice and stable also. Let's look at the rest of your knee. Let's take the synovium out so we can see that ACL with a shaver. There you go. Get that fat pad out of the way. There's your ACL stump that's sitting right in the middle of your knee. Here it is. We'll go ahead and clean that up for you. Take it out. There's everything in back of this is the PCL. So we'll clean up that old ligament. There's the top portion of it. Take an arthro-care, kind of clean that up a little bit better for you. Is it an 8? Right, so push down here now. All right. Give more towels, please. Can't see back there. Paul, come on over here, hold the leg for a second so I can see this posterior horn. All right, so you've got a tear back here, the lateral meniscus. You got a lot of the synovium that's torn here. We may have to do a repair. Let's take a shaver and clean this up a little bit so we can see better. Come in, light handle, please. All right, so you see you've torn up this meniscus pretty good in the mid-body here. It's torn here and it's torn there. You have a little peripheral tear here that we may end up putting a couple stitches in. In fact, I think I will put a stitch in this right here because I think this portion of it should heal if we put a couple stitches in this peripheral tear. Better than taking the whole thing out. Otherwise, we're taking a big piece of meniscus out. So let me have a Predator and let's clean that up first. shaver. Extend a little bit. You don't have to do that with the shaver in there because it's going to suck everything out. Probe. Posterior horn, mid body's okay. We're going to have to put a stitch in that meniscus, so we'll come from the other side and do that. Arthur, here, please. What we're going to do is put a stitch back here. We may put one underneath if we have to, but let's put a stitch. Kind of a very unstable tear of your meniscus, but if we can get one stitch so it doesn't propagate, I think we'll be in good shape. I think we can get that stitch in. Take a tire. All right, we'll cinch this one down. Show you it back here. I think that should do the trick. Let's look underneath it. Have a probe. Yeah, let's put a stitch underneath it too. You got a pretty nice hole here. Let's go. A little less, Paul, so I can get that out of the way. Put this first stitch in the meniscus up top here. See if we can get it to fire. Hopefully it will. Well, let's see if we can get it to come out. Now we need another anchor. Yeah, we need another anchor. Push down underneath. So we're going to cinch this one down underneath. I think that'll do the trick. Have a shaver, then a probe. Here's your stitch on top. Here's your stitch underneath. We got a nice repair there. The rest of the meniscus looks pretty sharp. Look at that medial meniscus, so have a shaver. Change your gloves. Change your gloves. Alright, so I think we've got a nice meniscectomy here. We've cleaned up your meniscus from the back. Mid-body transition zone. And all we need to do is get this little stump out in front. I'll take a straight predator forceps, please, a large one. Go large predator. take a shaver. All right, I think we're good here. There's the meniscus, looks pretty good. Terminal condyle, let me have a shaver and we'll clean the rest up. So you actually sheared off a little bit of the cartilage, but there's no fracture there, just a little cartilage fracture, not a chondral fracture. The kneecap still sits right in the center of the trochlea, which is great, and I don't think that you're that loose right now, so I think we're going to leave your retinaculum well enough alone. I think that should scar up pretty nicely for a guy who's not 18, 19, 20 years old, and I think by fixing that retinaculum we may be a little bit too tight. We'll see at the end. If your kneecap feels unstable, we'll certainly do it. So let's come from the other side so we can clean up that cartilage divot. So your cartilage defect here, we're just going to kind of clean up a bit. And we'll leave enough, the rest intact. We'll look at that retinaculum in a couple minutes, make sure that we don't have to do anything with it. Let's come back down here and start with your ACL. Put that post on. All right, what we're going to do is bring this graft. This graft should go right into that tunnel. So crank it up here. Looks pretty good. Let's go ahead and pull down on this one. And we'll pull up on these two pulleys. Pull down on it again. I think we're good. Where's the line for all right, so you've got a beautiful new ACL graft. Here's your allograft in full extension. Looks fantastic, nice and tight. That's full extension. We've got enough of that superior and lateral wall off, so that should do you right. Then if we go through flexion, we're going to see we've taken enough of that lateral wall off too in flexion that it shouldn't rub against you. Let me just clean up that roof a touch more just to make sure that we've got enough room here. All right. All right, let's go ahead and wash it out.